The benefits of exercise on mental health and your brain. Brought to you by Mac Engaged and Fit for Thought. What is Mac Engaged? A letter called Forward with Integrity was written by the president of McMaster University, Patrick Dean, and serves as an inspiration for the Mac Engaged project. This project aims to encourage students to use the knowledge they acquire in class to make an impact on the McMaster community, the local community, and the global community. Fit for Thought is our Mac Engaged project that takes concepts from our basic and clinical neuroscience class and applies it to 4 different communities to raise awareness and knowledge on the benefits of exercise on mental health. The 4 places that we plan to target are St. Joseph's, Toronto Catholic District School Board, Free the Children, and McMaster University. This presentation will focus on raising awareness for the benefits of exercise on mental health in dementia and Alzheimer's patients at St. Joseph's Villa in our local community.
Those living with Alzheimer's and dementia show damage in 3 regions of their brain. The prefrontal cortex is involved in complex cognitive behavior, personality, and social behavior. The amygdala is responsible for memory and emotion, and the hippocampus is involved in long-term and short-term memory. It is also commonly the first damaged region.
Individuals in long-term care facilities often endure long periods of inactivity. This inactivity results in reduced cerebral blood flow and thus reduced neural activity and ultimately depression. Excess amounts of inactivity can also result in an increase in cortisol levels in the brain, which results in an increase in stress levels.
How can exercise help? Aerobic exercise has been found to be a preventative measure for cognitive decline, depression, and dementia. It provides an opportunity for social interaction, as well as enhances learning. Exercise can also increase neuroplasticity and neurogenesis. Studies have found that individuals who exercise regularly present better cognitive scores than those who do not. This can be attributed to larger hippocampal volumes.
What are the benefits of exercise as a treatment? Current medications for the treatment of dementia target dysfunctions in the amygdala that are associated with aggression and agitation. However, these medications have some nasty side effects, including nausea, vomiting, weight loss, and depression. This is where exercise comes in. Exercise is able to treat the same dysfunction in the amygdala without all the nasty side effects. Exercise can increase cerebral blood flow by 2-fold and, as a result, increase neural activity. It also serves antidepressant functions by increasing levels of monoamines such as serotonin. Exercise can also increase prefrontal cortex activity, increase the volume of the hippocampus, and increase the function of the amygdala.
Seated exercise, for those who are handicapped, has also been found to be beneficial in relieving symptoms of anxiety for up to 12 weeks after regularly exercising. It is less strenuous and has been found to improve muscle strength and balance. Seated exercises can include, but are not limited to, marching, turning from side to side, raising the heels and toes, bending and bicycling the legs, making circles with the arms, and bending the arms.
Music has been found to have cognitive benefits to the brain. In Alzheimer's patients, the ability to recognize familiar music remains relatively intact. And so, like exercise, it can be used to reduce anxiety, agitation, and depression, while also increasing motor control and function through the use of rhythm. Music can also be used to motivate and encourage social activity and participation.
Our plan. Fit for Thought wants to implement a seated Zumba recreational therapy activity at St. Joseph's long-term care facility. Seated Zumba incorporates both music and exercise and all of their cognitive, social, and motor benefits.
What we did. On March 10, 2015, Fit for Thought went into St. Joseph's Villa in Dundas to implement our seated Zumba activity. These are just a few photos from our day with the residents.
For more information on the benefits of exercise on mental health, or if you have any questions, please email us at fitforthought.macengaged@gmail.com.